Hi, Sonia.
Hi Vic, how are
It's
you?
lovely to be with you tonight.
Thank you, likewise. How are you?
I'm good, thank you. I'm good. A busy day here at Breast Cancer now, but all good.
Good, I'm glad. So Vic, I'll get straight into it. We've had a couple of questions sent in.
Hmm.
So what I'll do is we'll start off with a few of those questions, and once the questions start coming in, we can start answering them as well.
Yeah, what a good idea.
Yeah,
Perfect.
thank you. So the first question that we have is from, just going to have a look, is from Faiza, and what she's asked is, does phylloides borderline tumor require a mastectomy?
Right, that's a very interesting question. And some people may not have heard of a tumours are rare and they're normally benign, but some of them are malignant. So if we say benign, that means it's not invasive. If we say malignant, it is invasive cancer. So there are three types of amyloidosis tumour. There's benign, there's borderline, which Faiza is talking about, and there's malignant. So with borderline, it means that it's got features between benign, so non-invasive, and malignant, invasive, so a cancer. So Faiza, with any of these phylloides tumour, and you're talking specifically about a borderline tumour, they do need to be removed, and the treatment, the first line of treatment, is usually surgery. Now, Faiza, that depends. The type of surgery depends on many things. It depends on where it is in the position of your breast, and also the size of the phylloides as well. Now, what the surgeons are aiming to achieve is that they have a clear margin around it. Now, if you think of a margin as like a border, so it's a clear edge around it. So most phylloides tumours can be removed with a lumpectomy, but again, it does depend on the size. So, Faiza, it's quite difficult to answer your question specifically because we can't say whether you need a mastectomy because obviously we don't know where it is in your breast and the size. So, do talk to your treatment team about that. And also, you may want to be aware on depending on what the pathology, so the final results show, you may need what we call some adjuvant treatment, so that's some follow-up treatment, and that may be in the form of radiotherapy. So it's difficult to answer your question, Faiza, because there are many variables to it. But we have got information on our website about phylloides tumour and also about surgery and radiotherapy that you might be interested in reading. So I hope that helps you.
Yeah,
So Sonia, I wonder if I should ask you a question now.
go for it. Yeah.
So Kelly's asked a question, and this is such a good question, Sonia, because on the helpline we often hear about people getting delays in the treatment of their breast cancer. But
Mhm.
Kelly's asking specifically, would a 4 to 5 month delay in getting a diagnosis
Mm.
affect possibility of recurrence, and would it affect the treatment plan by much?
That's a really good question, Kelly and Vic. You're right. That is quite commonly asked on our helpline. I think there's a few things to say possibly with regard to what Kelly has asked. So I think firstly, it would be important to understand why there's been a delay. And so Kelly, what you might find helpful is contacting your treatment team and to find out why exactly there's been a delay, because in some instances, you know, you might need to go through a number of investigations in order to finally get a diagnosis. And I think sometimes that can be perceived to be a delay, but in actuality, having imaging can then prompt further sort of investigations, biopsies, and so forth, so that your treatment team can ultimately finalize a treatment plan for you. Nowadays with breast cancer treatment, it's very much so tailorized to the individual, and so there isn't a one size fits all. And so you might find that the 4 to 5 month delay that you've experienced is because of your treatment team trying to ascertain what treatment you may need. Alternatively, what you could also do, Kelly, is contact your local PALS department, and what they can do is investigate sort of on your behalf why you feel there may have been a delay. But I think to answer your question as to whether that would affect the possibility of recurrence, and your treatment plan, it's similar to what Vic said,
I
with
was
Waze's
thinking that,
question, in that,
Sonia. Yeah.
yeah, there's sort of a number of factors that come into play, aren't there? It's sort of the grading of the cancer, the receptor status, the size, your age as well. All of these sort of factors are taken into consideration when determining what treatment you may need. And equally, I think it'd be important for you to speak to your treatment team about your individual risk, because it's different for many women. There is no sort of a specific risk for every breast cancer patient in general, if that makes any sense at all.
Well,
But I think,
Sonia, it does, and I
yeah,
think, like you say, it's like pieces of a jigsaw puzzle, isn't it? All being put together to
yeah,
see actually the best treatment for you. And sometimes that can be hard because that means waiting. But of course, we don't know the reason why Kelly is having to wait the 4 or 5 months. So I think everything that you
yeah.
say is really important. So
Yeah. But Kelly, equally, if you'd prefer to give us a call as well on the helpline to talk through this in a bit more detail, we can absolutely do that with you. But yes, definitely do go back to your treatment team, and they can hopefully help you to understand why there's been a delay of 4 to 5 months and how that will
yeah,
impact you. So, Vic, I'll go ahead with another question that was sent in. Let's have a look. So this is a really good one. So Shelley has wrote in and asked, I've watched the Amy Dowden documentary earlier this week. She found it really emotional as her 36-year-old daughter was diagnosed with breast cancer last year. She's finished her treatment and is doing really well physically, but it brought it all back. So what she said is, my daughter is really struggling to come to terms with her diagnosis.
right, goodness, Shelley, you've got it must be a very difficult time for you and your family over the last year. And I think it's really important to acknowledge the emotional impact of a breast cancer diagnosis, and Shelley, for you, especially for your daughter. And as Sonia said previously, we hear on the helpline from many people affected by breast cancer, including mums where their daughter has breast cancer, and it can be a real mix of emotions for all that. So Shelley, we're here for you and for your daughter too, if you ever want to talk through any of that. Now, it's your daughter. It's very typical, I think, Sonia, isn't it, of what we hear, that often when you're in the throes of a diagnosis and treatment, it's many people have described it as being like on a roller coaster ride where you're just holding on tight for the next twist and turn, waiting for to happen. And then actually when you finish your treatment, you get off this proverbial roller coaster, and it's often at that time where you think, oh my goodness, what was that all about? And we hear a lot about that. And at Breast Cancer Now, we've got support tailored specifically for younger women like your daughter. So we've got some younger women together events. Now at Breast Cancer Now, for us, younger women is 45 and under. So in our younger women together events, we either have 1 day or a 2 day event where younger women can come together. And it's really powerful seeing these women together because no one really quite understands unless they've been through it. So it's an amazing service. I've been involved with quite a few events, and they're a great source of support for the women that do attend. Our next one is in Liverpool at the end of September. So whether that's something your daughter may want to come to, depending on where you are in the country, but we do run them all over the country as well, and more information can be seen in on our website as well. Your daughter may also be interested in our Younger Women Together online programme. This is a 4-week programme where, again, younger women 45 and under talk about their experiences. They what we call connect and share with each other, and then we have guest speakers talking about, the psychological impact of a cancer diagnosis, dealing with relationships and menopausal symptoms. So there's a whole range of things, but more information can be seen on our website. Shelley, you might also be interested, both for you and your daughter, about our Someone Like Me service. So, Someone Like Me is a peer support service where you can link up with someone who's been in a similar situation. I often use the word buddies because I think it's quite nice to have a buddy. So, for your daughter, it may be another younger woman who's gone through breast cancer and, experienced some of the challenges that your daughter has. And also for you, Shelley, to be in contact with another mum. I know the feedback we've had from our Someone Like Me service has been really positive because you connect with someone who understands. So more information about that service is on our website. We also have, you probably know, we've done many live chats, and there was a session by Sarah Swan that talked about the psychological impact of cancer, and she's talking about acceptance and commitment therapy. So that's also something that you may find, and you can find our live talks on our website. So I hope there's a lot of information there, Shelley, but I hope that helps. And also, like Sonia said previously, please do call us on our helpline. We've got time to listen, and we can talk through your concerns. And also, if your daughter wants to call us, we'll be here to listen.
Absolutely. Yeah.
Yeah.
Thanks, Vic.
So, Sonia, shall I ask you a question now? So, we've had a question from Irene. So,
Yeah.
Irene says she's 6 weeks following a mastectomy with instant reconstruction. So not quite sure what type of reconstruction. And that was closely followed by an axillary node lymph node clearance. When will my swelling, tightness ease, and when will I start to feel better?
Thank you for that question, Irene. 6 weeks in after a mastectomy and reconstruction, I think it's difficult really to say how when you will start to feel better. I think what I can say is that with time, you should find that you should slowly start to feel well in yourself, and you will find that you're slowly starting to improve. In sort of getting back into your normal sort of activities of daily living. So you said that you've got swelling and tightness. I think it might be, you may find it helpful to speak to your breast care nurse or your treatment team for them to assess you firstly, to find out why you've got that swelling and tightness, because there could be a number of reasons why you're experiencing that post surgically, and they may be able to do simple interventions to help with minimizing the swelling and the tightness that you're feeling, and just talk you through, for example, exercises to do that could help ease that. For instance, wearing a good supportive post-operative bra, for example. But I would say give yourself time. There is no sort of set time frame as such. I think everybody heals in their own way, and it does take time for everybody. But what I would say is, obviously, if there was anything that you were concerned about, so you mentioned the swelling and tightness, I think do speak to your treatment team and discuss it with them. But otherwise, I would say give yourself some time.
Yeah, that sounds really sensible. And it seems as though Irene's having a difficult time, isn't it? She's had a mastectomy and followed by a axillary node clearance. So it sounds as though you've had a couple of surgeries in close succession. But as Sonia said, it is best to just check it over, because it's really difficult, Irene, isn't it, to know what's normal and what's not normal. And if you've had reconstruction, it really is best to talk to your treatment team, as they're best placed to assess you. And I promise you, you're not wasting anyone's time. It's really important. You're important, and it's important
Absolutely.
that this gets checked out.
Absolutely. Thanks, Vic, for that. So Claire, another question Claire has asked. I would like to know if you can push for a double mastectomy if you have been told you're having a mastectomy on your left breast where the tumours are.
Claire, this is a really interesting question, and within the breast cancer community, there's a lot of debate on this. So, when you have a mastectomy for breast cancer, that's a mastectomy for medical purposes. Now, if you were to have your other breast removed on the healthy breast, that would be what we call a prophylactic mastectomy. So that means removing the breast to prevent a breast cancer coming back. So it's preventative surgery rather than because there is a problem in that breast. Now, some breast surgeons believe and have a way of thinking that actually what they want to do first of all is concentrate on the breast that has the cancer and deal with that, and then have a further conversation about having the other breast removed. Now, it's generally a guideline that if you have a healthy breast removed, you need to have what we call a psychological assessment, and that sounds quite in depth to do that. But the reason for that is that no surgeon wants to remove a part of your body that doesn't need to be removed. Now, that's physical reasons, we have to understand the psychological reasons for why you want a mastectomy, and they can be very strong. So, in answer to your question, Claire, it's not out of the question to ask for it. Surgeons do have different viewpoints on it, and obviously, they're very concerned that some women, and certainly when I was in clinical practice, I don't know about you, Sonia, but I've known people that have had a prophylactic mastectomy and then have regretted it. So that's why it might seem really clear at this moment in time that you want the other breast removed. But most breast surgeons and treatment teams sort of advise you to take maybe a little bit more time to think about whether that is actually what you want. And of course, you've got to take into consideration whether you want reconstruction or not, or whether you want to be flat. So, Claire, it's such a good question, and a question that certainly when I was in practice came across a lot. But I think, like Sonia said previously, do ring our helpline to talk it through, but also it's really important that you talk to your treatment team to see, because obviously, Claire, we don't know the reasons why you want to have the prophylactic mastectomy. So absolutely hear what you're saying, and it's a really valid question, and it's really important to talk it through.
Yeah, thank you, Vic. And I think there's no right or wrong answer to that. I think it's as you said. If you have a specific reason as to why you want double mastectomy instead of just the single mastectomy, communicate that with your team, because they will always advocate what they think is best for you as well. And it's a sort of a decision making. It's a joint decision making process, and you can always weigh up
Absolutely.
the pros and cons, benefits of risks of both.
Absolutely.
Yeah.
Yeah. Yeah, that's good advice, Sonia. Now, Sonia, we've had a question from Irene, who's asked. So she's been asked, I wonder if this is the same Irene that had the
Yeah.
mastectomy. I wonder whether it is. Hi, Irene, if it is. She's been asked to consider the BRCA test.
Okay.
So Irene says she has no children or sisters. So is there a benefit to my taking part?
Okay. That's a good question, Irene. And well, I guess it's again. I feel like I'm sounding very repetitive, but I think it's a personal choice. It's a decision as to whether you want to do it or not. And what I would say is that there will always be a benefit. But that's if you want to undertake the BRCA. In that, although you don't have children or sisters, if you did go ahead and undertake the genetic testing, and you did find that you did have a gene mutation, then you could kind of consider preventative options, as Vic, you've sort of touched upon, sort of prophylaxis mastectomy. So you could look at treatment to help reduce the risk of developing a breast cancer, essentially. So I think that there's always benefits. Well, there's always pros and cons to anything really, and I think it's just about whether you would like to know what your risk would be in developing a breast cancer in the future, and what that would mean for you. But yeah, I think absolutely. I think talk it through with your treatment team, and if it's something that you don't wish to pursue because of the fact that you don't have children or sisters, and you think that it's not right for you at this moment in time, then that's absolutely okay as well. And if you wanted to revisit it at a later time, then you could always absolutely do that as well.
Yeah, that's a really good point. And Sonia, just picking up, Irene, Sonia talked about a gene mutation. You may also hear it called a gene alteration. So just to say that they use those words interchangeably. So just to be aware of that. And as Sonia says, as well as, so if you've got that information, what are you going to do with it? So like Sonia said, does that mean that you may want to take preventative surgery to prevent a breast cancer, or maybe it may put you at increased risk of ovarian cancer, but also you may be eligible for more treatment options for your breast cancer now. So do talk it through with your treatment team, because it's just more, isn't it, than just saying, oh yes, I'll have the test. It's what are the consequences of that. So
Absolutely, yeah.
yeah.
Yeah, thank you for adding that, yeah.
Yeah, no, that's fine.
All right, Vic. So we've got Debbie. Debbie has asked, how long does it take for the seroma to get easier? So Debbie has had surgery 14 days ago, which is not long at all. So she had a mastectomy on one side.
Right, okay. Thanks for your question, Debbie. So, a seroma is quite a common side effect of breast cancer surgery. And what it is, it's a protein type fluid that your body produces. It helps healing. But what often happens is that your body produces more of this protein fluid than it absorbs. And so, what can happen, Debbie, for people like yourself that have had a mastectomy specifically, it's more, you can feel it more in a mastectomy, can't you, often, Sonia? It feels a bit squishy, a bit like a hot water bottle, and sometimes people can even hear it swishing, that
Yeah,
fluid, can't
absolutely.
it?
Yeah, yeah.
And often you find there are pockets of fluid within the mastectomy wound. So there are different schools of thought on this, Debbie. Now, some breast teams, breast surgeons, like to drain a seroma, and so if you drain it, you may hear the word aspirate. So that means injecting a needle and syringe, and then actually manually draining the fluid off. It doesn't hurt because the area's numb anyway from the surgery. But of course, every time you put a needle into the body, there's a slight risk of infection. So some surgeons actually prefer not to drain a seroma and let the body absorb it naturally. However, sometimes if there's a lot of fluid, that can put tension on the wound that can actually cause more problems. So it's very individualized, Debbie. So seromas do settle down in time. Whether they need any intervention is very much dependent, Debbie, on how it feels for you. And you say it feels, you don't say it feels tight, but if you get a feeling of tightness, and of course, very occasionally seromas can get infected, so it's important to keep an eye on it and make sure the area is not red, or if you feel unwell, but do get that checked out by your breast care team, Debbie. Again, like with the other questions, it's not a silly thing to ask. You will not be a nuisance to anybody. It's really important that you get that checked out. But they can settle down in a few weeks. Sometimes it takes a little bit longer, doesn't it,
Yeah,
Sonia? It does sort of
absolutely.
depend.
And I think the reassuring thing, Debbie, is that with a seroma, it's not life threatening. It's not harmful in any way. And so it's as Vic said. I mean, it does depend on if you wanted to leave it be, it will eventually reabsorb. Equally, if you're finding that it's uncomfortable for you, then absolutely you can go to your treatment team, your breast care nurse, and discuss the possibility of getting that aspirated. But it's definitely something that will settle with time.
Yeah, thank you, Sonia. So we've had a question in from Sylvia. So Sylvia had a lumpectomy in March last year, and she's on anastrozole. And Sylvia has a question that we hear so much about, don't we, on the helpline and on our Ask Our Nurse service and any of our events, that Sylvia's been through a lot of joint pain, and her arthritis has been exacerbated by being on the estrogen blocker, which of course anastrozole is. So the discomfort seems to go in cycles. But Sylvia's saying the main problem is ongoing fatigue. And I can so understand this, Sylvia. You said you're fed up with feeling exhausted all the time. She tries to do most things in the morning and rest in the afternoon and evening. Well, I always have this fatigue. So it's a biggie, isn't it, Sonia? It's such a biggie, cancer-related fatigue.
Absolutely, yeah. And I'm sorry, Sylvia, that you're having these issues with the anastrozole. Will you always have the fatigue? Unfortunately, that's not something that I can answer. But what I can say is that, I think if you really are struggling with the anastrozole, definitely speak to your treatment team. Speak to your breast care nurse, explain to them exactly how you're feeling, and I think it's important that you do understand that with any of these with treatment for breast cancer, and especially with the hormone treatment that you're on for a minimum of 5 years, your quality of life is just as important as taking the medication. And I think if essentially if it's limiting you from getting on with your day-to-day activities, and you're really struggling, especially as you said with the fatigue, then that's certainly something that needs to be communicated with your team, because they can perhaps look at alternatives for you, and see how you manage with alternatives. Or equally, they can look at the anastrozole and find ways in which they can help minimize the symptoms that you're experiencing, and that could be in a number of ways. For example, in reducing the dose that you're taking of the anastrozole, possibly giving you a bit of a break from the anastrozole, and then revisiting the anastrozole in a few weeks or a month or two time, possibly taking it alternate days. I think the point being is that there is always something that can be done to hopefully manage how you're feeling, and it's not something that you sort of have to put up with or bear with. And I think Vic, I'm sure Vic probably feels the same, in that we can completely appreciate how difficult it must be in having to take this every day for the next few years. So I think do communicate with your team that you are feeling exhausted. If they do think, if it is exhaustion in relation to the anastrozole, then absolutely, as I said, they can find ways to manage that. But they can also possibly explore why you are having this exhaustion all the time, and the joint pain and the arthritis that you're having. Obviously, if the anastrozole is exasperating that, then, as I said, they can always look at alternatives for you.
Yeah, it sounds as though you've got a lot going on, Sylvia, doesn't it, with your joint pain and arthritis and the fatigue. And we know that there is a concept called cancer-related fatigue. It's different, Sonia, isn't it, from fatigue that anyone may get. And often people describe it as being hit like a brick wall. That fatigue just hits, and it can be debilitating, can't it, Sonia? It really can. So it sounds like you're doing everything right, Sylvia. You're doing things in the morning and then resting, but you may want to actually consider splitting up doing things. So not just doing things in the morning, but maybe doing something in the morning and then resting, and then doing something else in the afternoon and resting. So often it's talked about, they call it the boom bust cycle. So, maybe one day, Sylvia, you wake up and you've got a bit of energy and you think, oh, great, I'm going to, I don't know, clean the house, do all this. And then you're absolutely exhausted for the afternoon and maybe the next day afterwards. So sometimes it may help just simplifying the things that you've got to do. Say, for example, if you were thinking of doing housework, to clean one bedroom and then rest and get your energy back, and then do something else in small doses. But we have got some information on our website about managing fatigue. And also, Sylvia, you might find this helpful in that we've previously done a live chat with an expert about fatigue. So you might find some hints and tips of doing that. So yeah, and Sylvia, again, do ring us on the helpline, because it sounds as though you've got a lot going on, and Sonia's been brilliant in explaining it all, but there's quite a lot going on for you, so we're here for you.
Yeah, thank you, Vic. Those were really good suggestions there. So we've got another question from Nafisa. Hi, Nafisa. So it's a lot of surgery related questions.
There are tonight, aren't there? Yeah.
So Nafisa has asked, how long does it take to fully heal from a single mastectomy and lymph node removal?
Right, Nafisa. Well, I hope your surgery went well and that you are beginning to heal. Sonia, it's difficult to answer that, isn't it? It's a bit like how long's a piece of string, really. You had a single mastectomy, so I'm hearing from that you didn't have reconstruction and you had your lymph nodes removed. So generally our bodies are really good at healing, aren't they? Generally, unless you've got complications, such as if you're a smoker or you may have diabetes. But generally you heal pretty well. And if you were to look at your wound, certainly in a week or so, the bruising subsides, and you begin to get form a scar. But Nafisa, you must remember that there's a lot of healing that's going on inside the body as well. So it's really important that you keep doing your exercises, your arm exercises, to prevent you from having a stiff shoulder. But really, healing can take, a few weeks, but
Mm.
actually many weeks, to actually heal inside as well. So we would always say, listen to your body. It's really important to be as physically active as you can, to have a good diet, and rest when your body's telling you to rest. I don't know if you've got anything to add to that, Sonia,
No,
really.
no, I completely agree. I think yeah, give it time. It sounds like it's still early days, but yeah, any concerns that you have, do contact your breast care nurse and treatment team. As Vic said, nothing is ever too small. That's what your treatment team is there for. But yeah, give yourself time to recover. And any new changes or concerns that you have, do speak to your treatment team, and they can hopefully give you some assurance or advice if need be.
Yeah, that's great advice. Brilliant.
So, did you want to ask me a question, Vic?
Yeah, I'm sorry. Yes,
No, that's
it's
okay.
my turn, wasn't it? I forgot about that. Sorry. So we've had a question in from Katie,
Yeah.
and who's asking about guidance around food and nutrition following stages of treatment, chemotherapy, radiotherapy, and tamoxifen. And Katie recognises that taking a healthy diet, she knows a healthy, balanced diet is important, but
Absolutely.
is interested in whether there's any food it shouldn't have. She said grapefruit, and whether any might compromise medicines, and whether taking supplements will be a good thing or not.
Sure.
So Katie's currently recovering from a therapeutic mammoplasty following a diagnosis of lobular breast cancer, of which was estrogen and progesterone positive. So,
Okay.
how often do we hear? We have
Yeah.
so many questions, don't we, Sonia, about the
Absolutely.
use of supplements? And I think it's Katie, it's such a good question to ask.
Really
Thank
is,
you.
yeah. That really is. Firstly, I hope you're recovering well from your surgery, Katie, and thank you for your question. As Vic said, it's again a very commonly asked question on our helpline. What you should be eating, what you should be avoiding. But I think you've kind of answered your own question in the sense that having a healthy, balanced diet is key. It's important. Not only will it help you throughout the different stages of treatment, but equally having a healthy diet alongside exercising and checking your breasts, having the treatment, all of these things reduce the risk of a recurrence ultimately. Whether you should be taking supplements or not, that really is a question that you should definitely address with your treatment team, because again, you're right in saying that certain supplements do interact with breast cancer treatment. And so dependent on what supplement that you were possibly wanting to take, I would say do speak to your treatment team, and they can talk you through whether it's completely safe to take or not. But what I would say is that there isn't any particular supplement that we would recommend or suggest as such. It's just to maintain a healthy, balanced diet, eating sort of everything in moderation, and otherwise, if as I said, if there was anything that you wanted to take, speak to your treatment team. And what else did you ask? So, well, what I was going to say was that we do have some amazing resources on our website on having a sort of a well balanced diet. So you can look at that on our website. The Memorial Sloan and Kettering, isn't it, Vic? They
Sloan
have
Kettering, that's
yeah.
right. Yeah.
So they have they're a great resource as well. So what you can do is if there was any supplements that you were interested in taking, have a look on their website, and it can actually show you if there were any sort of contraindications and whether it's safe to take or not. In particular, you mentioned grapefruit. I think it might be worth running that past your treatment team. I'm not sure aware, Vic, if there's any, because I think there is.
But there are, it can
Yeah,
it contraindicate with some medication, certainly. So it's always best to check. And like Sonia said, Katie, the thing is with supplements and herbal remedies is that they're not regulated the same way as conventional medicines are. So, and some of them do affect blood clotting and things like that. And some of them may contain sources of estrogen. So obviously, if you've got an estrogen positive breast cancer, or even if you didn't, we would
Mm,
still say check it out with your treatment team. And you're right, Sonia. I don't know about you, Sonia, but I also find the pharmacists a huge source
absolutely,
of
yes.
support for things
Yeah,
like this. So it's a really good question that you've asked, Katie. But do just check because of that the regulation. It's not the same.
absolutely.
And like you say, Sonia, on our website, we've got information on different sources because there's a European website as well that you can
Yes,
put
yeah,
in the supplement that you're thinking about and it will guide you. But yeah, treatment team or pharmacist,
absolutely.
definitely. And yeah, we wish you a speedy recovery.
Yeah. Thank you, Vic. All right. Is it my turn for a question now?
I think so. Yeah.
Yeah. All right. So Tracy has asked, "Hello, Tracy." So she has had a mastectomy as well, like many of the women watching today. So she had a mastectomy in April. Her lump was DCIS, but it was found in the lymph nodes. So she's having chemotherapy at the moment. How does she know all the cancer has gone?
Right. Thank you for your question, Tracy, and I hope you're recovering well from your mastectomy. So you say your lump was DCIS, so we know that is ductal carcinoma in situ. So that's a non-invasive type of breast cancer. But you say it was found in the lymph nodes, which I don't know about you, Sonia, but it makes me suggest there was an
An
element of
invasive.
invasive
Yeah.
disease there in the fact that it's the nature of it that it's gone to the lymph nodes. So you're going through chemo at the moment. So it's quite difficult to answer this question, Tracy, because we don't know whether you've had all your lymph nodes removed. So, normally, I don't know about you, Sonia, but I would say that if you have some lymph nodes removed and they found some cancer, then you would go on and have the remainder of the lymph nodes
Yes.
removed to check that. So it's difficult to say, Tracy, exactly. But you say you're going through chemotherapy at the moment. So chemotherapy, Tracy, is generally given. Some people describe it as a mop up, don't they, Sonia? And that's really that if there were any stray cancer cells, Tracy, that the chemotherapy would kill those. So it's a really hard question to answer in many ways because how do we know all the cancer has gone?
Yeah.
What we do know is that your treatment team will be giving you the best treatment for your particular conversation, for your situation, I beg your pardon. And there's no real way, Tracy, of saying how do we know it's all gone. But I guess we have to have faith in the treatment, but that you've got. And I guess Tracy, that sort of leads on to a sort of a conversational topic about recurrence or secondary breast cancer. And we have got information on our website about the signs and symptoms to look out for. And it's really hard, Sonia, isn't it? Because we're talking about here a primary breast cancer where the focus is on treatment, and now we're talking about yes, but if it comes back. But it's really important to be aware of the signs and symptoms of secondary breast cancer so that you
Yeah.
can get the right treatment at the right time as soon as possible. So, Tracy, I hope your chemotherapy is going well, and yeah, do call us through to the helpline so we can talk it through. Or, Tracy, if you're worried about the cancer coming back, then do talk to your treatment team as
Mm,
well and tell them
absolutely.
about your concerns. Again, you're not wasting anyone's time. What you're feeling, if you're feeling anxious about it, we don't know that you are, Tracy, but if you are, it's a really valid emotion to have, and we get that.
Absolutely. And Tracy, it might be helpful when you do speak to your treatment team, if you do, about how you're feeling, about whether the cancer's gone or not. They can talk you through why you've had the treatment that you've had thus far, and it can talk you through what how that would benefit and reduce the risk of recurrence in the future, and that might be reassuring for you.
Yeah.
But no, as Vic said, it's absolutely normal to feel sort of concerned about where you are at, as how the treatment that you've had so far has helped in
Yeah.
treating the cancer.
And that's a really good point, Sonia, isn't it? Because if you understand why you're having that
Mm,
treatment, that sort of, you can make more sense of it, can't you?
absolutely,
So,
yeah, yeah.
yeah, brilliant. So, Sonia, shall I
Mm.
ask you a question?
Yes, please
Or
go
did
for
I
it.
just ask you one? I can't remember.
I think I just asked you one, so it's my turn
Right,
now.
okay, goodness. So we've had a question in from Laura, Sonia,
Yeah.
and Laura said her breast cancer was not initially picked up on a mammogram. So
Okay.
she's asking, can she ask for an MRI scan as part of her yearly follow up? What a good question that is,
Yeah.
Laura.
Really good question, Laura. Thank you for that question. So if your breast cancer was not initially picked up, so if it was what we call mammographically occult, then you can absolutely have that discussion with your treatment team as to whether you could have additional imaging alongside a mammogram as part of your yearly follow up. You haven't mentioned your age, but in particularly younger women, we have found that you have dense breasts, and so mammograms perhaps are not as effective in picking up changes. But as we age, our mammograms are obviously best suited at picking up any changes and picking up sort of changes in the breast. But what you could certainly do is speak to your treatment team about having an MRI, and they can discuss the benefits of having an MRI either as a standalone for your follow up for over the next few years, or as I said, alongside having a mammogram. A mammogram is the standard follow up, and it's still always a useful resource in detecting breast cancers and new changes, as I said. But absolutely, you can always speak to your treatment team about whether you would benefit from an MRI as well.
Yeah, and Sonia, it's a bit like our previous question, isn't it? It's about understanding why we have what we have,
Mm.
and why would you have an MRI scan? Why would you not? And sometimes, often, breast surgeon or radiologist will say, well, because the cancer, although it wasn't seen, the surgery will be so. But there's lots of things to sort of consider, isn't it? But it's certainly
Absolutely, yeah.
worth an ask. You're right.
Yes, yeah.
Yeah, yeah. Well, Sonia, I can't believe it. We've got through all our questions, I think, or most of them.
Yes,
But
yeah.
I think it's time for us to say cheerio, isn't it? I think.
I agree. Thank you all for your questions. I think there were a lot of surgically related questions, weren't they, Vic? But yeah, thank you so much
Yeah.
for
Oh, thank you, everyone, and good
thank you.
night.